Checking the wristband. Okay, accurate. So what's the reason that you used your call light? What seems to be the reason? So you experience discomfort, mucus buildup. Okay. So since the patient is experiencing mucus buildup, we will do nasotracheal suctioning for the patient. And as I just perform hand hygiene, I will make sure the patient is in semi-Fowler's position. I will hyperoxygenate the patient for 1 minute, 100%. Okay. And I will keep the suctioning there. Make sure it's in place. Seems a bit crooked. Is that comfortable for you, Mr. Brown? Okay. So now I will educate my patient. So for the nasotracheal suctioning, we will be using a catheter, and we will insert it through your nares and go down to your carina. Once it hits your carina, you will usually cough or you will feel some discomfort. So if you do end up feeling any type of discomfort, I would like you to clap or touch the side of the bed rail. And once you experience that cough, I will pull out 1 centimeter. I'll pull out 1 centimeter and swirl 10 to 15 seconds. I will do 2 passes, and if the 2 passes do not seem to relieve the mucus buildup, I will resort to a 3rd pass if 100% necessary. So, patient is in semi-Fowler's. I have the patient's pulse ox on. His oxygen sat seems to be okay. Okay, so now I will be turning on the suctioning. And it's on regular. Suctioning's on regular. So typically you want the suctioning to be at 80 to 120 on regular. And the intermittently suctioning as you're putting the catheter inside. Well, not as you put the catheter inside and you pull out, swirling for the 10 to 15 seconds. That's when you apply the intermittently suctioning. You do not apply continuous suctioning for that part. So now I will be placing a drape on my patient, just fixing it up. Patient to be as comfortable as possible. Okay, so now that the drape is on, I'll be performing hand hygiene before assessing my sterile equipment. Okay, so now I will be getting my 0.9 normal saline right here, and the basin for the saline. As I open it, I will lip the solution to remove the first layer because of the microorganisms. Now I'll pour the solution in. That seems to be a good amount. So now I'll close it. And now I will start my sterile procedure. I just finished pouring hand hygiene, so now I will start the procedure. And at this point, I will be putting on my sterile gloves. discard of the paper. And at this time, I will grab my catheter to use for suction. And once my hand touches the suctioning tube, this becomes an aseptic technique. So I will have my dominant hand sterile and I will have my non-dominant hand clean. Okay. So now I will grab the suctioning, and now as I'm touching the suctioning, my left hand is now clean. Just to double check. It's on regular 8120. Okay. Now I will apply the tube to suction and chest it out. I will put it, just to double check, I usually put it into the water and check to see if the suction is working, and it's working. I also checked at the tube and used my thumb, and it was working. So now I will lube up this catheter, and I will instruct Mr. Brown to take deep breaths, and I will also inform him once again that if he feels any discomfort or feels like he can't breathe as well, to either clap his hands or touch the side of the bed rail, so I will know he's experiencing discomfort. So at this time, my catheter is lubed and I'm ready to start my procedure. So, Mr. Brown, can you take nice deep breaths for me as I insert the catheter? And I would insert the catheter until it hits the carina. And I will know it hits the carina as my patient coughs. Then I will pull it out 1 centimeter, and then I will twirl for 10 to 15 seconds, only 2 passes. Okay, so now pull out 1 centimeter, suction, twirl, twirl, twirl. Okay. Now I'll add water if I feel like the catheter has buildup, needs to be cleaned out. Okay. Mr. Brown, take nice deep breaths for me. And I'll repeat the same process. Okay, 1 centimeter, twirl, suction, suctioning, twirl, suctioning, twirl, suctioning. So now, Mr. Brown, how do you feel? You feel relieved? You feel more comfortable now? That's good. That was the goal. That's what we do the nasotracheal suctioning, so you can be relieved of mucus buildup, and we want you to be as comfortable as possible. So that's the whole point of this procedure. So my patient indicated that they are comfortable, so a third pass will not be needed, and we will not need any more of the saline solution. So with that being said, I will remove the suctioning, and if needed, I will hyperoxygenate my patient 100% again. But he said he's feeling fine and is not experiencing any discomfort. His post-ox is reading well within normal limits. So at this point, I will proceed to remove my sterile equipment and proceed. And now at this point, both of my hands are clean, so I can touch both of my hands with the tube. So, and the suctioning just turned out perfect timing. So. Now leave the suction. Now I have the suctioning tube in my hands. Okay. Okay. So now all of this, I will dispose of it carefully. Hand hygiene. Once again, remove the gown from Mr. Brown. So, Mr. Brown, how are you feeling? I'm so glad I was able to relieve your mucus buildup. That's great. So you said you're feeling not comfortable. You're comfortable? Okay, that's good. That was the goal. We wanted you as comfortable as possible. So now that Mr. Brown is comfortable, we want him as comfortable as possible. Now that he is comfortable, I'll go proceed and do other things I have to do. But before I leave, I will leave the call light right next to you. So if you do ever experience any more discomfort, or if you need help going to the bathroom, or if you need anything, just use your call lights right here. I put it right next to your arm, right here. So if you need help with anything, experiencing discomfort, difficulty breathing, the oxygen is not working, use your call light and we will be here ASAP. Thank you. I'm glad I was able to relieve your mucus buildup. Thank you.